you ever woken up with red, watery eyes and thought it was just allergies? Well, it might actually be something else. Viral conjunctivitis, better known as pink eye. Today, let's break down what it is, how it spreads, how we diagnose it, and most importantly, how we treat and how we prevent it. So, viral conjunctivitis is one of the most common eye infections worldwide. Most cases are caused by adenoviruses. This is the same group of viruses that give us colds. It spreads super easily through direct contact, contaminated surfaces, swimming pools, or even coughing and sneezing. These types of outbreaks are common in schools, hospitals, workplaces, pretty much anywhere where people are close together. And there's also a few important subtypes that we should talk about. There's pharyngeal conjunctival fever, or PCF. This is conjunctivitis with sore throat and fever, and often in kids after swimming. There's also epidemic keratoconjunctivitis, or EKC, and this is the most severe form, very contagious, and it can cause pseudomembranes and corneal infiltrates. There's also acute hemorrhagic conjunctivitis. This is from rapid outbreaks marked by subconjunctival hemorrhages. And of course, herpes simplex conjunctivitis. These are usually unilateral and may have eyelid blisters or corneal ulcers. So how does it look? Well, patients usually develop red, irritated eyes with lots of watery discharge, not pus. And it often starts in one eye and spreads to the other within a couple of days. Other signs include itching, light sensitivity, and sometimes a swollen lymph node right in front of the ear. If you do a physical exam, you'll often see a follicular reaction. This is typical for viral conjunctivitis, and in severe cases, it can even cause pseudomembranes or small corneal spots that blur the vision temporarily. So how do we diagnose it? Honestly, most of the time it's clinical. Your doctor can tell just by looking at it. Sometimes you can do a rapid antigen test or PCR to confirm the virus, but those are usually reserved for outbreaks or like really severe cases. You can also do a slit lamp exam to rule out any other serious eye condition. So here's the big question: how do we treat it? So unfortunately, there is no magic antiviral cure. The first line of treatment is supportive care. So you can do artificial tears to soothe irritation, cold compresses to reduce swelling, and antihistamine drops if it's very itchy. And the most important part, well, hygiene. So you need to wash your hands often. It's not recommended to share towels, to share makeup, and avoid touching your eyes. And in rare severe cases, an ophthalmologist may prescribe steroid drops, but only under close supervision. Surgery isn't usually a part of the story, but like we mentioned, there might be severe pseudomembranes. So if there's layers of inflammatory tissue on the eye, a specialist may carefully remove them to prevent scarring. So what about prognosis? Well, the good news is that viral conjunctivitis is self-limited, so most cases clear up on their own in 1 to 3 weeks. Vision will return to normal. Though those little corneal spots may linger a little bit longer, long-term damage is very rare. Red flags for urgent referral include severe pain, vision loss, corneal ulcers, recurrent unilateral cases, or dead pseudomembranes. Of course, not every red eye is viral conjunctivitis. Doctors also consider bacterial conjunctivitis, which causes pus and sticky eyelids, allergic conjunctivitis, which is very itchy and seasonal, and hepatic eye disease, which usually affects one eye and comes with blisters on the eyelid. That's why getting the right diagnosis really, really matters in this case. So to wrap it up, viral conjunctivitis is common, contagious, and uncomfortable, but not dangerous. So with supportive care, good hygiene, and a little patience, it can clear up on its own. So protect your eyes, protect others, and if you're ever unsure, see a doctor. Thanks for watching and take care of your vision.